Hi, I'm Heidi Otway, your host for this Conversations on Cannabis virtual forum brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. In this conversation, we're talking about cannabis and what pharmacists want you to know about using this drug and the impacts it can have on your prescribed medications. Let's meet the guests for today's show. Dr. Valeria Robinson Baker has more than 30 years of experience running pharmacies inside hospitals in Central Florida. Dr. Robinson Baker, thanks for being our guest today. Tell us more about yourself and your experience.
Well, thank you for having me today. After working in hospitals for so long, I decided to work for a compounding pharmacy. And we were one of the first 503B FDA approved compounding facilities. So we test drugs, we dispense drugs, et cetera, et cetera. But right now I'm over the hazardous drug program and also over the non-sterile program. I am certified in medication therapy management as well as sterile compounding.
All right. Well,
Thank
thank you.
you.
We're going to learn so much about your experience and expertise as we dive into this conversation. Our other guest is Dr. Carlesha Herring, who is also a pharmacist, and she now does research in the cannabis industry. Dr. Herring, tell us more about yourself and your experience.
Thank you, Heidi. And again, it is my pleasure to be able to do this outreach to the community that is very much needed. I have a history of working also in the hospital as a pharmacist. I've been the director of the hospital in several of them, and I've done consulting as well. And currently, my role is in the medical cannabis industry, more on the research and development side. And we pretty much test the batches for potency, terpenes, flavonoids, and any microbials or heavy metals that may be in the product. And we ensure that it is compliant with state standards.
Okay, well, thank you so much for being our guest, and we're going to dive more into your experience doing that kind of work. To everyone joining us on this live forum, please share, post, and tag a friend on Facebook to have them join this conversation. If you're on YouTube, share the link so others can join us as well. During the forum, we want you to send us your questions in the comment box, and we'll do our best to have our guests answer them, and the Mary team will respond in the comments. We also want you to tell us what you think about this forum by completing the survey that will be posted in the comments on YouTube and Facebook after this live program. Your name will be entered into a drawing on December 2nd, 2021 to win a $100 gift provided by one of Mary's partners. So let's dive into our conversation about cannabis and your prescription drugs by first learning how these two pharmacists became involved in the cannabis industry. So Dr. Herring, tell us about your transition from being a pharmacist in the insurance and healthcare industry to your role in the cannabis industry.
It actually was an accident. I actually connected, and this is really the best way to do it. I connected with someone using my LinkedIn profile from one of the companies. Actually, I put my resume out to several of them. They liked my experience because I do have a wide range. Not like you said, I have hospital as well as I work for a large pharmacy benefits manager, and we
Mhm.
work closely with Medicare, Medicaid, billing, and that kind of thing. And they liked what I could bring to the table as far as my knowledge of pharmaceutical, medicinal chemistry. I actually worked in a lab, and that is my interest kind of sparked. I had done pretty much everything that a pharmacist could do. I've worked in pretty much every industry in pharmacy, and this was something upcoming and new. I've always been interested in herbs, which, if anyone, I'm going to tell my age. If anyone had Dr. Massey back in the day at the College of Pharmacy, she taught us a
At
wonderful
Florida A&M
semester of,
University. Yeah.
yes, of herbs. So that kind of started it way back then, and here I am today.
Okay, great. So, Dr. Robinson Baker, tell us about your transition. How did you get involved in the cannabis and public education on the topic?
Actually, my interest came from owning property in Tallahassee and trying to come up with an option of what to do with it.
Yeah.
And the cannabis industry came out and they were looking for locations. And of course, I started reading a whole lot and taking courses and seeing how I could get engaged. But that became a larger piece once Mary contacted me for talking about drug therapy and cannabis, I just came in whole hog on this part and kind of left the other one alone. I'm going to leave that to the others to do. So my interest was really about being a farmer for the industry.
Okay, that's amazing. I'm glad to hear
Yes,
that. And I hope that comes to pass. I
I
really do. We
do.
know that there's a lot of changes that are happening in the state to get more Black farmers
Yes,
into the industry. So you also serve on Mary's Advisory Council. I want to throw that out there for folks who are listening because that's a real important role that you play to advise Mary. So let's kind of shift back into, so you all are both pharmacists, and now that you all have moved into learning more about the cannabis industry and you're in the cannabis industry to some degree, do you have a different view of cannabis and plant-based medicines compared to pharmaceuticals? Dr.
Well,
I
Herring?
absolutely, yes.
So tell us about that. What's your view now?
Well, I didn't realize how many people are actually using cannabis.
mhm,
If you go to the dispensaries, it is literally it goes across all demographics, all age groups, and how widely used it is, and it's not talked about. And it should be. It needs to be a common conversation. You need to be speaking to your doctor if you're using cannabis, whether it's medical or otherwise. You need to be talking to your doctor or your pharmacist about it because it's very important and it needs to be talked about more.
Okay. Dr. Robinson Baker, what is your point of view now about cannabis versus
I
pharmaceuticals?
I totally agree with Dr. Herring. More people are in it than you would ever know, and
Hmm.
the issue is more about lack of knowledge in terms of how that interacts with the drugs that they're taking.
Right.
Yeah.
And it is, to me, an opportunity to go away from using harsher drugs because we just got a report recently that opioid overdoses were increasing instead of going.
Yes, it's at an
Yes.
all-time high.
So
Yes.
that's a little alarming when we have
Very.
options such as this to use
Hmm.
instead of. And so that means the education needs to be out there that the option is better to use the medicinal
Hmm.
marijuana instead of using, narcotics and et cetera, as
Hmm.
patients are being transitioned out of surgery or any kind of chronic pain situation. We want to look at medicinal marijuana instead of, or as a transitory piece to,
Hmm.
medications that we're using right now.
Well, let's dive into that a little bit more and let's talk about what are the advantages of using medical cannabis either instead of or along with a pharmaceutical. So tell us about, what those advantages are and what people need to know. Dr. Herring, you want to start with that?
I would say because especially if you're using the herb. Now, I will get to the tinctures, the edibles and all that shortly. But
Hmm.
if you're using the cannabis herb, like most herbs, it's very, very few major drug interactions. There are some, but it's not something that's going to kill you like other harsh pharmaceuticals. You can look on the commercials and you see, they have a lot of side effects. Marijuana has very minimal to no side effects in most users. Now, it's not everybody, but that's kind of how I think it's a lot safer. And I think it is the state has made many states, it's over 37 states now that have made medical marijuana accessible. It's
Yeah.
so very easily to get. So people should dive into that instead of or in addition to your regular pharmaceutical medication.
Hmm. Dr. Robinson Baker, let's talk a little bit about the difference. We talked about the advantages, the differences between this medical plant-based herb used as a medicine and a pharmaceutical, the difference in those.
The largest issue is it's chemically based.
Hmm.
Pharmaceuticals are chemically based.
Hmm.
They have, like she mentioned previously, there are a number of side effects associated with it. And then there are addictive properties that are associated as well. Not
Hmm.
to say that medicinal doesn't have that out there, but it's not as high.
Right.
The real issue here is we don't want our patients to get addicted to the drugs they're taking. And
Right.
side effects can go from constipation to overdose without
Mm-hmm.
knowing
Mm.
you're
Right.
overdosing. You take another pill
Right.
and you just took one too many.
Right.
And so I would prefer to go a route that is easier to manage for the patient. And again, the patient is not the knowledgeable one. It's us, the healthcare professionals that are. So if
Right.
I'm making a determination, I may make the determination of potentially how severe the issue is, starting there, and then moving to, if they're a willing patient, into the medicinal portion. Less addictive. That's what we don't want to see is
Right.
addiction. That's the
Right.
problem. That's the
Yes.
problem.
And that's the problem when it comes to pharmaceuticals versus medical cannabis.
That's
Mm-hmm.
it. That's it.
That's the difference. So let's say someone is listening to this and they have a medical condition and their doctor has provided them with, you know, prescribed medications, and they're thinking, well, maybe I should just get off the prescribed medications and just use cannabis. What would you say to them?
I would say to them, talk to their doctor about
Yes.
titrating off of it. And titration just means lowering what they're taking and then gradually moving on to the cannabis.
Mm-hmm.
And why say that? A lot of times people are getting the card to go get the cannabis, but they're not talking to their primary physician about it. That
Right.
should be a partnership, and it should also include the pharmacist. But the partnership should be the primary care physician knowing that this patient is or wants to use it, and
Mm-hmm.
then using a methodology of transitioning them to the
Right.
medical marijuana. And that would be my ideal way of going about it.
Dr. Herring, you want to
I
comment on that?
complete I completely agree. It is highly important, like we keep saying. Just because it's an herb does not mean that it is completely 100% safe and you can just do, especially like I said, I was going to come back to this. When you're getting a medical card and you have access to these edibles and tinctures and a whole variety of things, even though we do not have a classification yet as a drug, you're taking a drug. And these things interact with your regular medications. You need to have a licensed and knowledgeable healthcare professional involved in that. You should, even with the dosing. I've seen patient after patient has reported to me on these edibles. These things need to be microdosed. And because there is no federal approval at this time, it's not a lot of research on these things. So most of my studies are just on patient complaints and interactions and things that I've seen, I've witnessed one on one with patients, or they've just told me about it in a consult. People are even some of them, you can have a whole psychiatric episode if you're taking multiple edibles within a short period of time.
And we're talking about
Um,
gummies, cookies,
Gummies,
chocolate,
cookies,
brownies,
yes,
all of these new candy and
right,
sweet like uh,
yes. If
items
you
that
get
are
if
cannabis.
you get a medical cannabis brownie, please do not eat it, the whole thing. You need to force that baby or half it. It is not like the Duncan Hines that you're putting in your oven. It is
Yeah.
it is highly potent medical grade cannabis that has been concentrated into
Wow.
a butter or an oil and put in this food, but it's not, you can't think of it that way. And it's been a lot of people that get psychiatric episodes just by, you need to wait at least an hour before you dose again, at least, because the onset of action, it takes at least an hour. Sometimes some people feel it in 30 minutes, but most people it's about an hour. You need to wait before you dose it again. And
Hmm.
most of the packaging, it has no dose on it. So
Oh,
that's the thing where pharmacists need to get involved in this.
yeah, that's a great transition because I was going to say, what is the role of a pharmacist, in Florida? What is the role of pharmacists in Florida's growing medical marijuana industry?
Well, right now, what we're trying to do is get actively involved and
Hmm.
actively educated. That's happening on an ongoing basis.
Hmm.
And something key that Dr. Herring said, she said microdose.
Yeah.
Hmm.
That is
Yes,
not, that's not, let's just go ahead and cut off half and take half of it is microdosed.
right.
And that means you would need very little. But
Yeah.
Hmm.
pharmacists also are looking at educating themselves, There are courses that they can take online. You're
Mm-hmm.
seeing professional associations providing more information
Right.
on medical marijuana. Matter of fact, Florida Pharmacy Association has twice put on sessions where they talk about it in our meetings, our law meetings,
Mm-hmm.
so that
Yeah.
we know more and more about it. So there is an impetus to educate the pharmacists and make sure they're knowledgeable when they're talking to their patients about this therapy. But we're
Mm-hmm.
becoming more and more involved, and we know more and more about which medications interact, what you may need to do to adjust.
Mm-hmm.
And most pharmacists are very interested in knowing more about the medicinal marijuana because of the patient base.
Yeah.
Right.
And so is there a push to have pharmacists have a greater role? Because, if you look at the hierarchy of engagement for someone interested in using medical marijuana in Florida, I don't see anything in there about pharmacists.
Um, there is a push in terms of the individual pharmacists,
Okay.
their interests. They want to take care of their patients, and
Right,
they
right.
want to do it with all the knowledge they possibly can. So
Yeah.
therefore, a lot of it is personal driven.
Yeah,
A
right.
lot of it's personal driven, and
Hmm.
as that drive from the individual goes up, we'll see more happening from CVS and from the larger
Right.
entities that are out there. But it
Yeah.
takes the personal pharmacist that's out there trying to do the best he or
Yeah.
she can, to take care of their patient, and they are
Right.
the ones that are driving this force right now.
Yeah, in the taboo subject of marijuana, we kind of see it diminishing, right?
Yes.
As more and
Yes,
more people start adopting and using legal medical marijuana. So, what I'm hearing is that as more people start using it and want to have conversations with their pharmacists, we could see a shift in pharmacists having a greater role,
and
potentially.
that's why we're on here today, is
Yeah.
to
Right.
educate. And that means more people will be involved in going to their pharmacist and asking
Hmm.
the questions. And
Yeah.
so that's so important for us to do this in this form that we're doing it in.
Yeah, and we're so thrilled to have you. I mean, the response from the public has been so overwhelming on this particular topic. So we are certainly thrilled to have you here sharing your expertise. Let's go into some questions from folks who actually registered to participate in today's show, wanting to ask more about drug interactions in cannabis. We have a question from Jameson who's saying, what is the most important drug interaction and OTC interaction that someone can experience if they're also using cannabis?
Well, we've talked about this many times. One is that people who are on any kind of drug that is metabolized through the cytochrome P50 pathway in the
Mhm.
liver
Mhm.
will be affect any drug that's taken like that, and warfarin being one of them.
Warfarin
Um,
is used for
a blood thinning. It is a
a
blood
blood thinner. Okay.
and
Okay.
it can impact the INR, which is basically a tool to measure how thin the blood is, and the doctor uses that. You don't want to be on Coumadin, warfarin, same drug,
Yeah.
without having your INR measured or taken at least once a month. And
Oh.
that conversation needs to occur between you and your family practitioner. It needs to occur. Um, this is an important one. There are antibiotics that are affecting it.
Mhm.
You have one of two things that can happen. It can either accentuate the drugs that you're taking, like Xanax, if you're on that,
Mm-hmm.
or it can completely minimize or do away with
Wow.
the effect of the drug.
Yeah.
So with Coumadin or warfarin, it increases the INR, which means that you have increased bleeding. And so when you think about that, increased bleeding means that you could potentially throw a clot or have a
Mhm.
clot. And you're talking about
Ooh.
brain strokes, those kinds of things. So there is
Yeah.
some care and caution that needs to be you aware of when you're using that along with your Coumadin. And your physician needs to
Right.
be involved, and your pharmacist needs to be involved, so that
Yes.
we can tell you these things, and then
Yeah.
you'll be made aware of it. Even the responsibility of calling the physician to let the physician know that you're
Right.
taking. So
Absolutely.
marijuana is really key in all this. So those are some of the things that we as pharmacists can play a primary, actually a very integral role in your health care with drugs that interact with your medicinal marijuana.
Dr. Herring, did you want to add anything to that?
I did. I want to add an important one that people don't always think of, but it's alcohol. If you are drinking
Oh,
alcohol, which many people do, and it's not wrong if you're drinking it, within normal consumption, but alcohol actually increases THC levels in the body. In addition to that, there are herbs like St. John's wort, or even if you're on other psychotropic medications, whether it's for depression, anxiety, or otherwise, a psychiatric type schizophrenia, anything like that. Marijuana is a psychoactive drug. So anytime you're taking anything that deals with that area, you need to be cautious because you can have a whole psychiatric episode. Marijuana, most of the overdoses, which are not your physical body isn't necessarily going to be in harm. It's your mental health. Like you have to be cautious of that if you are on anything concerning your mental health. Marijuana is very psychoactive, especially if you're taking the not regular CBD, but the medicinal marijuana. You need to be cautious because it has been known most of the cases that come into the hospital, it's psychiatric issues. So
wow.
be caution with that. Use
So
Okay.
caution.
Well,
she's
we've got a lot of questions coming in. So, Dr. Robinson Baker, did you want to follow up on that?
Well, I just wanted to tell end on that because people don't think about psychoactive drugs. If you're on
Hmm.
Prozac,
Right,
anything like that, that is a drug that she's talking about. We want
right,
to be clear. So if you're on anything for depression, make
right.
sure you have a discussion with your
With your
primary
doctor.
physician.
Hmm.
Okay, well, I'm not a pharmacist, so I don't know what this drug is or what it's used for, but we have a question for Mr. Harrod asking, saying, how can my doctor allow me to use street marijuana with Xanax, then take me off Xanax after I get my medical marijuana card?
Well, we alluded to that very early in the conversation. It has an additive effect. And the
Hmm.
idea is that the physician is trying to transition
Right,
you off of the Xanax to the medical
Medical
marijuana
marijuana,
so
yeah.
that you don't have to use the Xanax. Xanax is very addicting,
it
as is
is.
Valium, and a
Now, what is
host
it used for again for people like me? I've heard it, but I honestly don't know what it is for.
anxiety,
Okay, so it's an
preventing
anxiety. Okay,
anxiety, yes.
okay. Mhm.
So there are people on it just to calm their nerves, um, take the edge off, as they say,
Right.
Mhm.
and it can be used therapeutically correctly.
Hmm.
But the idea, again, with all these drugs, they're addictive. We don't want you to
Hmm.
be addictive and need it and then, kind of go off the deep end of the use of the drug, using more of it to get the same effect. So
Right,
the transition has to occur with your primary physician transitioning you from that Xanax to something different that will give you the same effect or a
right.
similar effect.
Okay, well, we got a lot of questions that are also coming in on our YouTube and Facebook. So we're going to go to the question from Celia Myres. Celia Myres, who's asking, what are your thoughts on using recommending medical marijuana for pain management for certain surgeries versus pharmaceutical addictive pain drugs?
I'm going to chime in on this. This is very, very good question. Um, if you are having surgery and you think that smoking or ingesting marijuana one way or the other is going to take your pain, you are very it's not going to happen. What you should do, it's going to be a combination of you using a pharmaceutical product because no one needs to be in pain. Marijuana, it does have an indication for pain, but it's more for mild to moderate. It's not going to be for surgical pain or anything that is something excruciating like cancer pain and things. You're going to need it to use it what we call it's as an adjunct. You use it in addition to. So yeah,
Mhm.
that's a conversation you need to have with the doctor. But my professional opinion, it would be both. You would need uh, pharmaceutical as well as the medical with the doctor's approval.
Okay. Dr. Robinson Baker, did you want to chime in on that?
No, she said precisely the way it should be done,
Okay.
and no patient should be afraid to take the medication
Right.
in the hospital
Right.
because those meds are intended for severe pain.
Right.
Right.
When you're going in for surgery, hip
Right.
replacement, anything that's surgical, you
Mm-hmm.
need
Right.
something to kind of numb that pain for a
Right.
little while. Then you can transition,
Hmm.
Okay.
but not instead of.
Not
Right.
instead of. Okay, good. So let's go to Q the Gemini, who asked a question. Let's pull that one up from Q the Gemini on social. What conditions or illnesses would medical cannabis be better as a medicine than a prescription drug?
That's a very interesting question. And it's really something that can't really be answered because medical marijuana does not have, it's not very many studies out there for it. There are indications for it, but it's not many studies that say that you should use marijuana instead of or to replace a pharmaceutical medication. It's just no evidence out there for that.
And let me add on to that, as she said, there is not a lot of documentation.
Right,
A lot of it is anecdotal, meaning that
right,
it's done and then they see this effect. And so they say that possibly this is a great um, avenue to use, like seizures, especially in
Mm-hmm.
small children. The
Mm-hmm.
tinctures seem to work well for seizures, and those are severe seizures, small threshold for having a seizure. These kids are having seizures every 3 minutes. So
mm-hmm,
tinctures are used with them.
right,
Um, let's see, another one would be chronic and neuropathic pain. Sometimes diabetics will have these pains that are sharp and cutting from the inside out, and they seem to have some relief with the use of medical marijuana.
Mm-hmm.
Another one would be glaucoma.
Oh.
There has been some, like I said, anecdotal reports that it works well in glaucoma. So
Mm-hmm.
there's a host of things that are anecdotal. They're not proven, but there is some literature indicating there is some use for it.
Mm-hmm.
right. And
So,
also, you have to remember there are 3 FDA approved drugs.
Right. Mhm.
It's not the psychoactive form of medical marijuana, but they have
mhm.
Marinol, Sesamet, and also Epidolac. And it's kind of hard to get them because you have to have some pretty debilitating conditions. It's a
Yeah.
whole process because I used to do prior authorizations. You're not going to get the actual pill form unless you have cancer. They use it with cancer chemotherapy. They use it in nausea and vomiting
Mhm.
kind of things. But you have to have seriously debilitating conditions to get approved on the pharmaceutical side to use it. And they do have FDA approval, but it's not the same, it's not under the same umbrella as medical marijuana.
Now,
Mhm.
usually their use is for nausea and vomiting,
Right.
severe nausea and
Severe.
vomiting.
Right.
Mhm. So you kind of touched on some of the qualifying conditions, and also we wanted to talk a little bit about the rules and regulations when it comes to medical cannabis use in the state of Florida and also at the federal level. So let's talk about the qualifying conditions. Can you all share some of the qualifying conditions? We know that there are 9 to 12, if not more, and then there's some nuances in there. So let's talk about some of those qualifying conditions, and then also how can folks get a medical marijuana card in the state of Florida? Who wants to take that on?
I'll start it off by saying, number one, we have to remember the law in Florida states that regardless if it's state or federal, whatever is the strictest law is the one that we have to follow as
Hmm.
pharmacists.
Yeah.
This is a Schedule 1, so therefore we
Right.
have to treat it as a Schedule 1. It is considered a drug that does not have any medicinal use
Right.
according to the federal government.
Right.
Right.
And so we have to be cautious about our involvement with it. We really
Right.
do, even though we want more education and we know coming down the road hopefully FDA will change its category,
Yes.
the category. Let me just
Right.
get that
Yeah. Yeah.
to something that we can work with and not be afraid of touching.
Mm-hmm.
So
Yeah.
um, the categories in which it's used specifically, Dr. Herring, you might have to address that for me.
Okay. Yeah, they have some they have several, like about 10 or 12
Yeah.
qualifying conditions that
Mhm.
are in the statute. But if you go to a medical marijuana approved prescriber, there
Yeah.
are other little loopholes. Like I said, this is a very
Oh,
gray area. There are other conditions, like some of the major ones, it's HIV/AIDS, cancer, multiple sclerosis, chronic pain, Parkinson's
Mhm.
disease, epilepsy, any terminal condition. You can get your medical card in glaucoma.
Mhm.
But for us that have conditions that aren't quite as terminal or serious and life threatening, they have alcoholism. You can get it for arthritis, anxiety disorders, muscle spasms, menopause, lupus, IBS, because it has your in the endocannabinoid system is in every organ from the brain all the way down to your digestive to your
Mhm.
external extremities for pain
Mhm.
and things like that.
Mhm.
Fibromyalgia,
right,
all kind of things. You really should do a lot of research, but there is more than likely there's something you have that could qualify you for it, even
Right.
if it's not on the list of the 12 that are approved by Florida, because
Yeah.
right,
like it's under the doctor's, it's at the doctor's discretion.
Okay,
correct.
so I was going to say, so in addition to going to the site that you referenced, we also want to encourage people to go to the Florida Department of Health's Office of Medical Marijuana
Yeah,
Use because it has all the list of the qualifying conditions under statute. It also has the application where someone can apply if they want to get a medical marijuana card. And there's also the list of the 2,500 plus, I think it's almost close to 3,000 now, qualified physicians in the
right.
state of Florida that folks can go to for the recommendation. Um, so I want to throw that out there. So Dr. Robinson Baker, what do you want to add?
I just wanted to add to that. Early on, we had a lot of veterans that were on it, and it was used for post-traumatic disorders.
Yes,
So
that's
Yeah,
another one.
basically,
PTSD.
Mhm.
yes, they were one of the primary group that the physicians were treating with medical marijuana. So we left that one out, but that was a
That, yeah.
large group, large group.
Interesting, interesting. So I'm going to go to some questions again. We got a lot of questions coming in. So this one comes from Brian, and this goes back to some earlier in our conversation is, are actions taking place to allow pharmacists in chain drugstores to dispense marijuana? And his other thing was anywhere in the USA. So if you're not in Florida, because we know Florida is different, but any other states that allow pharmacists to have touch the plant and dispense?
There are some states that do allow it, and they're more progressive, and they've been in the business a little bit longer.
Right.
You can look at Oregon. There are a number of states that allow that to happen. And I think Maryland is one that I can remember, and they did it right. They did it right
Mhm.
from the beginning. They put it in the pharmacist's hands
Mm-hmm.
to make the decision on how that process was going to flow once
Right.
it was legalized. So there are a few states that the pharmacist is involved and taking care of the dispensing part and the review part
Yeah.
of this
Right.
therapy.
Dr. Herring, did you want to comment on that?
I do. And to add on to that, because I've done some research as well, it is most of the time when they do it, it's not going to be like a single wham bam, thank you, ma'am. I go to the pharmacy and get it. You're going to have to go to a pharmacist at your regular pharmacy, and it's kind of a separate thing. Where you have a medical marijuana dispensary that does strictly only marijuana based
Mhm.
products.
Yeah.
And it seems like the legislation that's coming up with the federal government, it seems like it's going to be separate, but no one really knows what's going to happen. But it seems like it's going to be a separate thing because the laws, it's treated differently. And like they even have some decriminalization things coming
Mhm.
up in the legislature.
Mhm.
Like this coming up in 2022 is going to be a big year for medical marijuana legislation. So
Yeah.
right now we really don't know, but the way that it looks, the way that the current laws are, it's going to be separate.
Okay. Okay, good. We have two questions. One that's come in from our folks watching online. So let's go to London's question, because this goes back into the conversation we've been talking about dosing and all these kinds of things. So London asks, what are medical cannabis treatment modes that you'd find most effective? So we talked a little bit about edibles earlier. We talked about tinctures. We talked about the smokable flower. So in you all's experience, learnings, experience as pharmacists as well, thoughts?
I tend to go with the tinctures more than I do the edibles. And that might be a little unique to Dr. Herring's position. She is working in that industry, so she has hands-on experience. But tinctures give you more control, and
Mhm.
drops or 5 or 6 drops is easy to understand, as opposed to a quarter of a brownie or a
Right.
half of a
A
gum.
sweet treat
That's right. Yeah.
with a glass of milk.
I tend to side with things that give me an absolute measurement,
Mhm.
and the
Right.
tinctures are those things that I tend to side with.
Okay. Dr. Herring.
And I agree with her. And this is our little pharmacist tin hat going off because we are big on dosing. You know exactly what dosing you're getting. And
Mhm.
but ultimately, what's going on now, everybody's body is different.
Yeah.
It's kind of like a trial and error thing. You try
Yeah.
it and you'll see what happens. But I think ultimately everybody it's at the patient's discretion, and some people like the more natural smokable marijuana. Some people like that. Honestly, ultimately, it is, I wouldn't say the safest, but it's the one with the least amount of side effects. Because if you give someone, and what has happened, if you give someone a tincture bottle of medical marijuana, and they instead of a few drops, they take full droppers full, they're going to end up in the hospital getting their stomach pumped, just like with edibles. If you take one and then, oh, I don't feel anything, I had somebody took 4 edibles at a time just because they thought they were gummies and tasted good.
Oh,
No, you're going to end up having to get your stomach pumped. So ultimately,
that's real.
you have to be very, very careful because it doesn't even really, it's not labeled like a pharmaceutical product. You have take one daily by mouth, twice a day, or whatever. It's not going to be like that. You have to be very, very careful. And if you want to get actual dosing correct and know exactly what you're getting, definitely go with the tinctures. If you want a more natural effect, go with the smokable that you're probably not going to get many side effects. If you want to take a risk, get some edibles. But just be careful. Be very careful.
Yeah.
Only do, like I said, microdose these things. That
Microdosing.
you don't know how it's going to affect your body. So just be careful.
Well, that goes
These,
into, oh, go ahead, Dr.
I was
Baker.
just going to say, these are some things that you learn as you go along the way.
Right.
Even with medication, the doctor gives you
Right.
a pain pill, and you take the one, and you feel woozy all day long. So
Hmm.
I can't take that whole pill.
One.
Yeah,
I'll do a half.
at the time, I can take a half and get the
Right.
pain relief that I'm looking for. So, as she said, everybody's pain tolerance is different, and you
Hmm.
don't know until you use it. But you want to start slowly and
Yes.
small with whatever you do.
Yes.
Yeah. So we've talked about dosing, we've talked about types of product, we've talked about the side effects if you are taking it, potential side effects if you're taking it with your prescribed drugs. So this is a good segue into a question that we just received from James that said, what information would you like dispensary sales staff to know when responding to a consumer?
Dr. Herring, you work in that market, so you would be one of the ones to have the
I would like the dispensaries to look at the pharmacist as a helper because a lot of times, especially I know my thing, what's happened to me, a lot of times they think that you're trying to overstep your boundaries or you're trying to like I work in compliance as well where I have to tell people, this is not the legal way to do it. We need to stick to, the rules that the state has put in place for us. I would tell the dispensaries because a lot of times they're not people that are in healthcare at all.
wall.
They just get a job and, they're young and they are not knowledgeable about how dangerous these things can be if taken in the wrong way. I
Yeah.
would advise them to be educated on the statutes, stay abreast of the upcoming things that are coming up. And if you have a pharmacist involved, utilize them as much, or a doctor or
Yeah.
any professional that is involved and knowledgeable about these things. Utilize them to the best of their ability because it's a difference from getting counseled. Currently, they have techs in there that they do have patient counseling techs, but they don't have the extensive training of a doctor, nurse, or pharmacist.
Yeah.
So when you have access to that, utilize it because
Yeah.
it's only a matter of time before it does become, I believe anyway, it's gonna be more regulated because and we don't want anything negative about marijuana. Like if you're dispensing to a patient and something happens to them, that's gonna get reported and it looks bad on the future of the industry.
Right.
So educate yourself, be kind to your pharmacists and doctors when they come in and try to let you know what's going on in the industry
Yeah.
and utilize them as much as possible.
Yeah.
And she said something very key about who's actually selling it to you in the dispensaries.
Right.
These are young people who have
Mhm.
some knowledge of the drug, but only enough to sell it to you.
Right.
And
Mhm.
so you have to understand you're limited by why they're selling it and um, their experience with the drug themselves.
Right.
So the best rule of thumb is to check with a pharmacist and
Right.
someone who works in a dispensary. Talk to a pharmacist and ask where I
Right.
can get more information.
Exactly.
There are courses they offer in that
Mhm.
industry, so you do know more about it. So I would ask them to educate themselves first, and then work with the healthcare professionals so they know what they're talking about when they're talking to
Right.
these patients.
Yeah, I think that's great. So we're getting some more questions from our folks watching online. Celia Myers has a follow-up question about dosing. And she says, can you share how quickly the various routes take effect? As you mentioned, the 1 hour time for edibles. So can we pick maybe three modes of product and how long it may take?
So yeah, edibles and tinctures are very similar. All of them go through what's called first pass metabolism, which means it has to go through your digestive tract, go through your liver, get metabolized, and then it's activated into the active THC and CBD compounds. So
Mm-hmm.
that's pretty much why you're having to wait an hour for it to take
Mhm.
effect. It has a very slow onset of action.
Okay.
If you're doing inhaled versions, whether it's the vape or just smokable, the flower is what they call it, smokable cannabis flower or
Mm-hmm.
CBD flower. You can even get without a medical card, by the way. They sell those at the smoke shop, just regular CBD flower, which has less than 0.3% of THC active.
I didn't know that.
Yes, you can. And
Mhm.
those pretty much take about 10, 15 minutes at the most. Um, and other ways, they even have topical. We have creams and ointments. Those it really depends on the person, but those work on contact, like or up to 5 or 15 minutes or so. It depends what kind of what you're trying to use it for. They have lotions that are just for moisturizing and things like that. That stuff
Mhm.
it's immediate action. So yeah, that's pretty much yeah, did you want to add something to it?
only saying that, it really depends on the population or the age.
True.
The younger would be more prone to smoke it. The
Mhm.
older would be more prone to use the gummy bears, something less threatening in terms of I'm not smoking marijuana.
Right.
Yeah.
Okay. So it really is about the individual and the age and their
Mhm.
perception of it. And so I would tend to think that your younger ones would be the more likely to inhale smoke,
Mhm.
Mhm.
unlike our president. But but your older would be more prone to the gummy bears or tinctures or something that they feel they
Mhm.
have more control of, and there's the stigma that's going away. Some people still have that stigma in their
Yeah.
mind, so that would be the only caveat.
Okay. Well, I
And
want to
one
throw.
other addition too, I forgot to
Yeah. Go
mention.
ahead.
This is very important. They have micro concentrates of things like waxes, crumbles, butters, and things. Those are. It depends on how you're using it. Most people they will. It's smokable, but it's highly concentrated. So all of those go into the 15-minute range if you're doing concentrate.
Okay. Well, that's a perfect segue into a question that we got from Dave Lang, who's watching online, who says, "How does the smoke from flower affect the lungs and cardiovascular system?"
That's a good question.
Question, yes.
Um, what I've researched is most patients that do regular vaporize or smoke marijuana, they typically do not have lung damage. But
Of
what
course.
it can cause is cardiovascular issues. Sometimes you can have tachycardia, which is a fast heart rate. You can get high blood pressure.
Hmm.
um, Most of the times it's cardiovascular type issues, but they've had people studies of people that have smoked for 20 and 30 plus years. Most of the time, the placebo versus the patient that's smoking marijuana, they don't really get lung damage. So
Hmm.
that's a good thing.
Okay.
But let me add to that. Another study said the medicinal marijuana gives you the effect that you're looking for without the toxins that are on the
Right,
street level. So
Right.
right.
there's a great positive in the medicinal marijuana that you're inhaling.
Great, great. Well, we have about 10 minutes left in the show, and I wanted to use this opportunity to ask you all if you all had any closing comments that you'd like to share with the audience and the folks who are listening to this program today. I'll start with you, Dr. Robinson Baker, and then I'll close with Dr. Herring.
Thank you. Thank you so much for joining us this afternoon to talk about medical marijuana and to get educated on its use. It's vital that you use a healthcare professional to guide you on how you take it, how much to take, et cetera, for your pain relief, for the various disease states and reasons you would be using it. I would suggest this is all going to uh, continue to change over time and
Mhm.
will become more exact in what we would recommend to you. But right now, we're still in the infancy of this market.
Yeah.
Right.
And so we're learning and growing just as the market is. The stock market is even involved at this point.
Oh,
So,
big time. Yes.
so the biggest thing is I want my patients to know is use your pharmacist. Don't be embarrassed.
Right.
Use us as a tool. We are there for you.
Right.
And there is no embarrassing question you could ever ask me, nor Dr. Herring for that matter, because we are here to be your advocate and to make sure that you are taking care of yourself and doing it with consciousness and knowledge.
Yeah.
So
That's
thank
really
you for having
important.
me on.
Thank you. Dr. Herring, closing thoughts.
I absolutely loved, and Dr. Robinson Baker summed up what I completely am for. I am, at the end of the day, I'm the pharmacist that's a patient advocate. I'm a pharmacist that kind of went into the industry when other pharmacists, they kind of don't want to touch it. So utilize your pharmacist. I will say the prohibition of marijuana is very soon it's slowly coming to an end because there are already over 37 states that have approved it. And we have to remember alcohol, used to be against the law. A lot of things used to be against the law. Laws change, and perceptions of medical marijuana use in the healthcare industry is changing very quickly.
Yeah.
There are so many physicians, so many nurses, so many pharmacists that have backed this and got it approved through the legislature in each of their states. So it is not something to be afraid to talk to someone about. Even if you want to pick a particular person, get a pharmacist that you feel comfortable with, a doctor you feel comfortable with. But it needs to be talked about because at the end of the day, it's about safety. It's about being safe and getting our patients the things that they need that help. And I'm going to close on this. I don't know if anyone has ever heard of Charlotte's Web, but it's a cannabis plant that it was a little girl. Her name was Charlotte. The plant was named after her because she was a epileptic patient, and they tried every pharmaceutical known to man on this child, and it
Hmm.
didn't work. She got
Yeah.
one dose of medical cannabis, smokable, and actually she started out on the pills too, but she did several, but the first time that she took it, it helped her. And that's where my side of the story is. I'm more on the clinical and research side. And if you're going to do it the legal way. It's
Yeah.
many avenues that you can go through to get it legal wise. The street level cannabis is not, I'm not going to say it's not safe, but it's not legal. And there are other things in cannabis that can harm you if you're not careful. Like the medical cannabis is tested at a high level, and it is monitored from seed to sale. Everything that goes into the plant, what is fed, the light, the dirt. It did everyone. I don't know if y'all know, but asbestos grows in dirt. There's all kind of microbes and mold and things that grow in dirt that is
Mhm.
dangerous to the human body. And if
Wow.
you're not getting a tested marijuana that has been approved through the different ways that, the ways that we do it to keep it safe for patients, then it's really unsafe. Well, it's not as safe as it could be. So it's accessible. Do a little research. I don't want to put any names out there, but if you just Google, there are several doctors here in Tallahassee that
Yeah,
will
and
prescribe
across
it
the
for
state.
you,
Yeah.
and you all across the state.
Yeah, across
Yeah,
the state, we're close to 3,000 qualified
yeah.
physicians that
Use
we
them
recommend. Use.
if you want to become a patient. Yeah.
Well, great. Well, Dr. Robinson Baker and Dr. Herring, thank you so much for being our guests on this Conversations on Cannabis virtual forum, brought to you by the Medical Marijuana Research and Education Initiative at Florida A&M University. Thank you to everyone watching and listening to this program. Tell us what you think about this forum by completing the survey that will be posted in the comment boxes on YouTube and Facebook after this live program. If you complete the survey, your name will be entered into a drawing on December 2nd, 2021 to win a $100 gift card provided by one of Mary's partners. We also want to encourage you to go to the Florida Department of Health Office of Medical Marijuana Use website to learn how to obtain a legal medical marijuana card in the state of Florida. We also encourage you to go to the Florida A&M University's Mary website to learn more about this initiative, its educational programs, and additional information about cannabis use in Florida. Thanks, everyone. Y'all have a good afternoon.